Why don't we move on to segment 3? Let's talk about innovative payment and delivery models. And of course, we've talked a little bit about this thus far, but this is clearly an area where there's no shortage of acronyms, right? We've heard about the ACOs and the PCMH and a whole variety of other types of arrangements. I guess a question I'd like to start off with is, given these models and some of the testing and piloting that has been done, for example, by the Centers for Medicare and Medicaid Innovation, what have we learned? Are they working?
I think some of them are working. I think that there's a mindset in policy about does X work? Where if you go out into the world where people run enterprises, it's not does X work, it's we're doing X and we're making it better all the time and we're constantly adjusting and so forth. I think, though, that until we have payment policies where you get rewarded if you're more efficient, and think about that. You don't currently get rewarded if you become more efficient.
Correct.
Become more efficient, you lose money. So who in their right mind is going to do that in a fee-for-service system? We do measures on overuse, okay? So we just have a new measure on prostate cancer screening for men over 70. Now, the urologists actually have come out against this. There's a lot of harm that's done, people being overtreated for prostate cancer, all kinds of bad impacts and so forth. What do you think the prostate cancer screening rate is in Medicare Advantage plans for men over 70? 40%. I don't know what it is in classic Medicare, but that's just an example. But you know what? I can measure overuse till the cows come home. As long as people are making money by overuse, they will do it. So we need a payment system that really gets people's incentives lined up in the right way.
Yeah, so what does that look like? I mean, you talked earlier about the assumption of risk and essentially said, well, we have shared savings, but shared savings is an assumption of risk.
I mean, I believe in capitation. There may be things that you need to carve out that are extraordinary and so forth, but we have people like Austin that can figure that out, right? And very effectively. For PCMHs, I mean, if you have a PCMH that doesn't get paid extra for doing care management, they're going to blow up. They can't do it. We've asked them now to take on a whole responsibility for population health management. They need a team, they need systems, they need to invest in all this. So you've got to give them a care management fee. So it depends on what level you're talking about. But if you're trying to get towards a more holistic problem-solving approach, fee-for-service is not going to do it.
That's right. And I think part of the key is going to be, looking at shared savings or bundled payments or whatever they are. They're great in theory, but they have to be paired with the tools to be able to get there. So, and I think this is going to be true all up and down the line. So for a primary care physician, you can't just say, well, we're going to bundle your payment and you'll share savings. It's, well, to do that, you need to set up a patient-centered medical home, and here's how you do it. Here, we'll help you. Here's how you structure it. Here's how you hire. Here are some interconnected IT systems. You're going to need help. Similarly, I think, and maybe we'll talk about this later, but patient engagement. How do you get the patient more engaged?
Right.
Well, you have to figure out what's going to motivate them. And it's not just, you're going to be on the hook for X, Y, or Z. You can't just say, if the concern is people are overutilizing the ER, you can't just say, all right, well, we're slapping a $100 copay on the ER. You got to figure out, okay, why? Why are these families using the ER? Is it because they work 2 jobs, they don't have childcare, and that's the only thing open when they're free? Is it because they're reliant on public transportation and every bus line in the city drops you off at the hospital, that none of them drop you off at a clinic? You've got to figure out why are they doing what they're doing that's wrong, and how do you empower them to do the right thing?